ceiling, we told you that Nigerian women who are working in America, the United States of America, were facing intimate partner violence, high levels of intimate partner violence. And we're continuing that conversation this week, and we're taking it in a slightly different direction. Now, if you remember, my guests and I told you that since the mid 2000s, there have been many cases of Nigerian American husbands of Nigerian American nurses actually murdering their wives. And my guest last week wrote an article about it 2 years ago that really delved into the cultural and social reasons why this is happening. And we talked about some of those at length last week. And you really had a lot to say as well. You kept calling. It was one of our topics with the highest amount of feedback from you. So thank you. Now, this week on the glass ceiling, we're continuing this topic. And we're looking at it from a different angle, like I mentioned. Whereas last week we were looking at the cultural forces at play, today let's look at the mental health and psychological side of this phenomenon. And we're not the first to do this, not at all. Some American researchers already looked into this particular issue. They conducted a study into the domestic and intimate partner violence among Nigerian nurses in the United States. And we have one of the doctors who conducted the research on our show today. He's the medical director of Herrera Community Care Center at Virginia, Connecticut Healthcare System. He's also project lead on the Happiness Project, which aims to increase access to evidence-based treatments for mental, neurological, and substance use disorders in Nigeria. And we're going to be talking to him about that work as well. His name is Dr. Thaddeus Ihanacho. Welcome to the glass ceiling, sir.
Oh, thank you for having me. I appreciate it.
Yes, of course. Now, I'm very curious what sparked your interest in researching domestic violence among Nigerian nurses.
So I was myself and my colleague, Dr. Charles Dike. We are at Yale and we practice psychiatry, and we are connected to the Nigerian community in the United States. And some of the nurses who are quite well organized here in the United States. There's a lot of Nigerian nurses, as you can imagine, in the United States. So they came to us actually saying that they've witnessed a lot of these fatal and deadly events among their colleagues in the United States, and they were wondering why and how to help address that issue. So this was really the National Association of Nigerian Nurses and Nigerian Nurses in North America. So they really commissioned us to study this phenomenon with them. And so the first thing we did was have a conversation with them, talk to a couple of their leaders, and decide on what's the best way to start looking at this issue. And so this was sort of a collaboration between us at Yale and the Nigerian nurses in the United States. And so that's how we started.
I understand that this study hasn't been published yet, but what are the findings that you can reveal for now? But first, before you get to that, can you tell me how long the study took? What were the parameters?
Also, this has been a study. It's been going on for at least 2 years.
Oh, wow.
Because with these, with like every study, you need to make sure you go through the usual sort of protocols, get permission to do the study, apply for institutional review approval, get all the consents that you need. So it took a while, and we needed to do some baseline sort of reviews as well about what's going on in the field and what other people have done. And then we delved into ours. So it took about 2 years or so.
Okay.
And so at this point, yes, we haven't published it. We presented our findings to the leaders they commissioned us to do the study. So we presented some facts, some findings to them, and then we done some presentation to the Association of Nigerian Physicians in the United States or North America. So the headlines, which I can tell you is obvious. There's a lot of domestic and intimate partner violence among Nigerian nurses in the United States. I can tell you there's a lot of that. we looked at two components, and to your point earlier, I think the intro you made, we looked at some of the parameters around this, and there are the cultural elements and the psychological elements, but also we look at what drives it. So when you think about violence, usually we think about the ultimate, which is maybe somebody shoots their wife or somebody shoots their husband, but that's usually kind of the end of it, right?
Yeah.
Usually there's a lot more around
That happened before
emotional
the death.
control.
Yes.
It happened before that. It starts out with that emotional control.
Okay.
It starts out with that verbal control, verbal abuse, emotional control. So there's a controlling element to this, and then there is the actual sort of physical violence. So those are the converging things we found out in terms of the study. So there has to be multiple ways of addressing it based on our findings so far.
Now, based on your research, but also on evidence, anecdotal evidence, what do you think are the main reasons why these women are on the receiving end of domestic violence at such a high rate?
So we have our theory based on our research and looking at the literature.
Okay.
As you rightly pointed out, and I think as most of us know, our Nigerian culture is a male-centric culture. In other words, our laws and our culture and our sort of traditions center around men having power. And so which can pose a challenge when you find yourself in a situation where the life revolves less around the man, then that can become an issue. And so that is one element to this. So, it takes a little bit of adjustment to know that, this is different and life is a little bit different than what you know. So that's one issue. The other issue that came up in terms of our research and also looking at the literature is the dynamic of living in the United States,
Okay.
or any European or any Western country for that matter.
Okay.
So some of the cultural and social mitigating factors that help address interpersonal relationship is not there. And I'll give you an example. If I was living in Nigeria with my wife, first of all, my parents will probably know about it, and they will tell me to sit down and behave yourself, right? And if it goes beyond my parents, then my in-laws and my family and my extended relatives will probably know about it, and they can easily without anybody worried, having a second thought about it. So that even as it's starting out, you kind of get corrected along the way. In the United States, it's really different, and I think in developed countries in general, it's just you and your wife essentially.
Okay.
And so some of those protective mitigating factors are not as strong as they are in Nigeria. So that's something that I think is important to think about. And then the third element is the idea of money. So when in situations where, and I think this is a general issue, in situations where the wife is earning more money than the husband, that can present a bit of a challenge. Anyway, so let me stop there because again, this is a very can be controversial, but yeah, those are based on our findings. These are the things that sort of was coming up for us.
Now, with domestic violence, how often is there a mental health issue with the aggressor?
Actually, our research doesn't actually show any major role for any serious mental health issue or substance abuse issue. Actually, in fact, the part of our findings so far is that in fact Nigerians and other immigrants in the United States are less likely to have issues around substance use, for example, or less likely to be involved with the law, for example. So, based on our findings, we didn't think any serious mental health issue was, driving some of these. However, I think you alluded to the issue of adjustment. I would say a bit of the psychological adjustment might be where the issue lies.
I see. Now, last week when I was talking to Irene Woye, who wrote the article about this, she wrote an article about this, and we were discussing the culture shock for some Nigerian men who move to America and find society that doesn't give a man control over his wife, and they have difficulty adjusting. And the question I couldn't ask them when I had them on the show was, what were the psychological reasons behind that failure to adjust? That's because they were not psychiatrists. But, we have one on the show today. So you can help us with that. What are the psychological reasons behind that failure to adjust?
So I don't want to claim to be an expert on this psychological adjustment, but I can tell you about it. I do, because I'm from Nigeria, by the way. So I lived in Nigeria. I left Nigeria when I was already in my late 20s, and so I kind of grew up in Nigeria. So I know the sort of interpersonal dynamics that can happen in Nigeria, both between couples and with families and with cultures. And I can tell you that it's a big adjustment when you are outside Nigeria. So different people adjust psychologically to different situations at different rates. So it can take a bit. So what's the problem? The problem is, I think, if you transplant, I'm going out on a limb here, and then people are going to have comments and suggestions. But I think if you travel outside Nigeria,
Mm-hmm.
you have to be willing to adjust to changes. General, just like anybody else, in Nigeria, and I'll give you an example. Most places in Nigeria, if you come 20 minutes, maybe 20 minutes late to work, not a big deal. Most places, in the traffic, in the West, if you don't come on time a couple of times, you're probably gonna lose your job. So most of us adjust fast. There's no African time. You have to be on time. So most of us adjust, and I'm using that as an example just to show that in general, you need psychological adjustment.
Mm-hmm.
However, when it comes to that interpersonal relationship, being married, girlfriend, I think that's where the challenge of psychological adjustment, meaning you have to now be more conscious of some of the more
of how you interact with
difficult dynamics that happens when your wife is how you interact with your wife. So for example, your wife is working 8 to 8, so 8 a.m. to 8 p.m. or 7 a.m. to 7 p.m. You don't have, your job is 9 to 5, so you come back before your wife, and I'm going to give you an example. I hope the men on your show doesn't kill me. In Nigeria, your wife will come back and make the dinner and serve the food. Well, if your wife is working, 8 to 8 in the United States, and you don't have a maid who is going, or a house help who is going to prepare the food, well, you can't be sitting down and watching TV and waiting for your wife to come back at 7 p.m. and then make dinner. When you have to make dinner, right? So or you should make dinner. I don't say you should make dinner or buy dinner or whatever, right? So I'm just using that as an example. So those little things can start
they pile up and become big things.
Yeah. It become big things, and they pile up, and the tiny little things like that. Then your wife is working in a place in the United States. She could have male friends. It's perfectly normal to go out with friends and have a drink and no strings attached. Well, the Nigerian man might look at it like, okay, well, my wife is going out. So there's a lot of psychological adjustment that it's tiny little, but it builds up.
How can these psychological problems be resolved, Dr. Hanacho? How does one help somebody who's going through that sort of culture shock? A Nigerian man and his wife is going out with male co-workers to go and have drinks. It's a culture shock. How do we help people like that? And now we have more and more Nigerians emigrating, right? More and more Nigerians immigrating, moving abroad. So if they get there or they come back and marry one small girl and take her abroad and, she starts to live like this, how should Nigerians like this, especially Nigerian men, be helped? How should they help themselves? Even if somebody cannot help them, how should they help themselves?
I mean, I think it's important awareness is important to be aware. Like, awareness is the primary thing. In other words, you have to know that this is an issue you have to deal with. So my people say, if you don't know where the rent starts beating you, then you would, so you have to know where the rent start. So you need to know what you need to change, right? So I think creating awareness of, if you marry this, if you go to Nigeria and you're in your 40s or 50s and you marry somebody who's in their 20s, that's already an issue. Like, you're going to have to deal with the United States. So I think just having awareness is the primary thing. Providing education. So we've been looking at all the options in terms of utilizing the community resources here to provide education and awareness around this issue. So that's primary thing. So awareness, acknowledgement. So I've become aware, then acknowledge that this is different, and I'm going to need to make an adjustment, and then start working on the adjustment. It takes a while because people are living their lives until they're in their 20s or 30s, and so it changes stuff. But I think those are the primary places to start from. And I think one thing that is our people are well connected to our churches. I do think that you going through the cultural aspects of our life here in the United States, most of us are connected to our churches and our mosques and our religious institutions. So I think walking through and then we have the association. Almost every community in the United States here, or Nigeria in the United States, have a community organization of their town union or their townspeople. So we're also thinking that we could walk through them to sort of, again, provide education, but also provide avenues to address some of these issues before they become more serious.
I'm glad that you brought up churches, because I want to tie this to some other work that you have done. We're big advocates of mental health here on Hard Facts. So when we found out about your work, we were quite excited. You've done a lot of work observing how the church in the Nigerian community perceives mental health issues. Now, we keep hearing that in many of these domestic violence cases, instead of going to the authorities or secular counseling, these couples go to the church or they go to family members. On average, this is how it happens, right? Now, I have to ask you, on average, how equipped is the church to handle these types of cases where there is definitely a psychological root to the violence?
So that's a very good point, and I really appreciate you bringing that up. I do think that just alluding, and I'll come back to this issue for here in the United States, but just alluding to Nigeria in general, I do think that if you go, you live in Nigeria, obviously, I live in Nigeria. So for us, the church and the mosque, and I want to say about the church more because I'm a Christian. So the churches are more sort of where everything kind of happens, both in terms of even medical and psychological. So we go to our churches. We're very connected to our churches. There are very stable institutions around the country. So I do think that just from a practical point of view, any intervention or trying to address mental health issues should include the churches, I think, because they are natural support systems for our people, and our people trust and go to their churches for psychological issues. So empowering the church and empowering church workers and actually training them is something that we've done in Nigeria, particularly in the southeast. We've done some work in Enugu with the Ogu Archdiocese of Catholic Archdiocese. We've trained the church-based health advisors to actually screen for depression among pregnant women. Okay. And we've got good results, and we're hoping that some Nigerians will get more interested in supporting and funding us to do more with the churches in Nigeria. So based off of that, our view here is that intervening and trying to help our people adjust to life in the United States should include the churches. However, I have some basic required training. In other words, you can't just say go to your church. I think we need to work with the churches to provide training and support so that they can adequately address and support our people through the churches, because they're already connected to them. But I think it's going to need they're going to need some support. And
hello, doctor. Hello. Yes, okay. We still have a connection. All right, then. Okay, so I'm particularly glad that you're doing this work, and I'd like to switch to talking about the Happiness Project. Is that what you've just talked about? The provision of mental health training and clinical support for primary care teams in participating Nigerian teams. That's what you've just told us that you are doing with the Ogo Diocese, for instance, in Enugu.
Yes.
Hello.
We are doing that with the churches. The other element that we're also doing in Nigeria is working with primary care teams in Nigeria to provide mental health in the community. Because on the research that's available, that's the easiest way gap in treatment. So because most Nigerians who struggle with psychological and mental health issues and don't have access to the specialist care that they need, like psychiatrists or psychiatric hospitals. But if you wanted to make sure that everybody gets a psychiatrist, there's going to take hundreds of years to do that. In the meantime, there's a lot of primary care teams around the communities, well established in different communities. So our target is to train as many primary care teams as possible to provide mental health treatment in the community, and then make referrals to specialist care as needed. So now we've tested this model in Owerri, Imo State, and it's kind of been working really well. And we've got some support from some foundations that have helped us do that. And the key here is providing that training to build capacity and providing ongoing support so that people in the communities can get access to mental health treatment.
I see. Now, if
it takes energy, it takes time, it takes some money. It takes some money to do.
Which brings me to the part where local government and state governments come in. If they want to be a part of the Happiness Project, how do they go about it?
They can send me an email. That's the quickest way to reach me. They can send me an email, and I can talk to whoever is interested, and we can bring our team. We do have a well-established and organized team at this point who can go out, do the training, and then also continue to provide ongoing support. We are using technology as much as we can to continue to bridge that gap between sort of general primary care teams and specialists. So we do have a team. We do have the support and the training, the capacity to do the training. We just need to be connected to people who are committed. If state primary care team, for example, is interested in doing this, they email me. We can set up some discussion and have a training, plan a training, and it's doable.
Okay, all right, Dr. Hanacho, thank you so much for talking to us on the glass ceiling.
Oh, you're welcome. Thank you very much for having me.
Well, this conversation is still streaming on Facebook, and we're going to take your calls now. And I have several questions that I have to ask. You've heard conversations between Irene and myself, as well as Bukola from last week. You heard the conversation between Dr. Ihanacho and myself right now. And I'm curious what your thoughts are. What do you think leads men to hit their wives or women to hit their husbands? How do you see the relationship between a husband and wife? What type of respect does a wife owe a husband? And what type of respect does a husband owe a wife? How should disrespect be handled in a marriage? Why is it a problem for some people that a woman makes more money than her husband? Do you believe, and I asked this last week as well, do you believe that a husband's worth is tied to how much he makes compared to his wife? When both husband and wife work outside the home, how should housework be allocated? Dr. Ihanacho just mentioned that when you move to countries in the West and the wife is working and you are working and she's doing like 8 to 8 or 7 to 7 and she comes home, you shouldn't expect her to cook. You should do the cooking. So it's an important question to ask, When both the husband and the wife work outside the home, how should housework be allocated? If you're going somewhere, by the way, you don't need to stop listening to your radio. You can listen online, nigeriainfo.fm, and we're definitely streaming on Twitter and Facebook and YouTube, Nigeria Info FM. Who should make financial decisions in the home? Is it the husband? Is it the wife? Is it both of them? Or whoever makes more money? I want women to call as well. Who is the head of the home? Should there be a head of the home? Is a head of the home needed? If you say a head of the home is not needed, what's your suggestion for running the home? How do you think a domestic violence should be handled? If a man is violent towards his wife or a woman is violent towards her husband, how do you think it should be handled? Should they call the police? Or is it family members that should settle it? So many questions, huh? We're going to take your calls after this break. You're listening to Hard Facts on 99.3 Nigeria Info. This is the glass ceiling. And on the glass ceiling, we talk about all the different barriers holding women back. And domestic violence is a huge one. And the doctor said it doesn't just get to domestic violence. It starts from an inability to control your emotions, and it continues to grow into domestic violence and, in some cases, death.
99.3 Nigeria Info. This is the Glass Ceiling on Hard Facts.
Hello, Lagos. On the Glass Ceiling, we have conversations about the different barriers that hold women back. And today we started conversations with Dr. Thaddeus Ihanacha. Thaddeus is a doctor from Yale University, and he just concluded some research on the reasons why domestic violence and murder is so rampant with Nigerian men who live in America with their Nigerian wives, So working Nigerian women in America, especially nurses, being killed by their husbands. And we had that conversation, very, very great, to be very honest with you. We started with why he did this research. We talked about how long his study took. We talked about why violence was at such a high rate. And if you missed all of that, you can always catch up on Facebook and YouTube. Also on our podcast, The Glass Ceiling has a podcast, and you can find it on your favorite podcast app. Just type in The Glass Ceiling with Sandra Ezekwesili. That's my name, by the way, Sandra Ezekwesili. And now it's time to talk with you. And I want to know what you think leads men to hit their wives. How do you see the relationship between husbands and wives? What type of respect does a wife owe a husband? And what type of respect does a husband owe a wife? How should respect be handled in a marriage? Ezekiel says it has a lot to do with foundation. I wonder what he means. Hello, Ezekiel.
Yeah, Sandra, good afternoon.
Good afternoon.
Yeah, this is Ezekiel from Epe.
Yes, welcome, Ezekiel.
You see, to every build up to a thing, foundation is critical. While you're talking to your guests, I was actually, I was very much curious to hear something.
Okay.
As in the course of the conversation,
okay.
And because the point is, if there is a development to a thing, and they discover that it's getting rampant, I believe the best way to nip it in the bud or to checkmate it is when punishment is being leveled against it. Are you getting what I'm trying to say?
Okay.
So, because in all of the conversation,
mm-hmm.
I've never had any form of punishable measures that have been leveled against everyone that have engaged in such acts. Because the point is, I said initially that foundation matters in everything.
Mm-hmm.
Foundation I mean in actual sense is the way and manner the partner sees themselves. Because in every relationship there must be mutual respect.
Okay.
And there must be, the knowledge must be there to know when to say goodbye and when to stay.
I see.
That's just the main thing. That's what I mean by foundation.
Okay. Now, I also, one of the questions, Ezekiel, hold on. One of the questions that I was asking earlier on is if you think that a head of the home is needed. Should there be a head of the home?
You said what? Come again.
Should there be a head of the home?
In everything, there must be a head. But the point is, it also boils down to what an author said, that when the purpose of a thing is known, abuse becomes inevitable. That a wife is collecting higher than you shouldn't be a problem at all. It should be an added advantage.
Okay.
Yeah, I'm telling you, that's why I said foundation in everything matters.
Foundation
and the
matters.
purpose of a thing. Hello?
Okay. All right, Ezekiel, thank you for calling. We have John. Hello, John. Thanks for calling us.
Hello.
Yes, welcome.
Yeah. I want to contribute. You see, civilization is good, but it's one of the problems we are having.
Okay.
You see, in those days, our parents, most of them, the women don't even work, but they still cater for their family. But these days, the women work and their husband. But because of some women don't have home training, they are not even up to the standard to marry. They will just rush inside the marriage without proper agreement.
Okay.
That is the reason why some men, even here I'm living, women are richer than their husband.
Okay.
I am married. My wife is richer than me.
Okay.
I support her because we have earlier agreement.
Okay.
If there is no agreement, you will see the man killing the woman. So women are even building their house without telling their husband. So women are taking care of their family. The husband is not aware. So agreement in marriage matters a lot. some families, the wife is the head of the family. So I just advise Nigerians should change their character according to what your guest I just said.
Okay.
That the relationship that you are into is for you to adapt. If you can travel out of Nigeria, go to another country, carry your family, you have to change. If you are somebody that is so jealous, white people are not jealous. You will see a married white woman kissing the cheek of another married man. It's not done here. So that is the real problem.
All right, John, thanks for calling and contributing to the show. We've got Oluwafemi who says the person who's more financially intelligent should be the head of the house. What does that mean, Oluwafemi?
That's correct. Okay, so because we live in a society where we live in a more patriarchal society, a society that tells a woman to submit to a man. Having said that, it is important to note that the person who is more financially intelligent, who has the intellectual prowess to make decisions, quote unquote, great decisions, should lead the pack. Just as you need an alpha male to lead the pack, you need a matriarch to lead the pack of hyenas, you also need someone who has gotten that prowess, that prudency to lead the pack, not necessarily the man, not necessarily the man. But, we live in a male-dominated society, quote and unquote. So it is going to be very difficult for this school of thought to eat the light. But this is what I believe. This is how I see life, It doesn't necessarily mean that I need to lead the pack. The woman can also make decisions. That's how I see it,
All right.
And then the issue of suicide, I think it is premeditated. What do you call it? Violence.
Domestic violence?
Yes, domestic violence is always premeditated.
Mm-hmm.
It always starts from that thought. I'm going to eat this girl one day. I'm going to eat this guy one day. Then it's going to happen like that. So that's how I feel.
Oluwafemi, thanks for calling and sharing your thoughts. Here's another question I have, by the way. Do you believe that domestic violence is a good reason to leave a marriage? Do you believe that domestic violence is a good reason to leave a marriage? How do you think domestic violence should be handled? If a man is violent towards his wife or a woman is violent towards her husband, how should it be handled? Should they call the police? Should the family members settle it? What if the family members settle it the first time and it keeps happening? Is domestic violence a good reason to leave a marriage? We've got Tokumbo on the line. Hello, Tokumbo. Welcome. Good evening. Yes, welcome. Hello? Yes, you're live on the show. Go ahead. Oh, that's quite unfortunate. Our numbers are 01277 0993, 01277 1993, 01277 2993, and 01277 3993. On Facebook, Uchonya Kwalu says that within the marriage context, the man is the head, even if the wife is earning higher than the man. The Western culture chafed this, and that's why there's so much problem in the family, and divorce is skyrocketing in those countries. We want to adopt their culture with regards to marriage. Nina Chantel says, here the men can cook and do laundry. Nothing wrong with that. Church is brainwashing African men to think that the woman is a slave to the man, not an individual. Here, women have rights. Chukwebuka in Shomolu, hello, welcome.
Hello, good evening.
Yes, good evening, Chukwebuka.
Yeah. Sandra. I think we need to learn a lot of things here, even those who have the intention of going to the Western world.
Okay.
I believe in one thing. I was sharing with my sister not quite long on this topic you are sharing right now.
Okay.
I used to have some friends who believe that even in the morning, their wives have to bath the children, prepare them, and they will be relaxed. And she still has to take water to the bathroom for them to have their bath. And even when they all go to work, they come back first and still expect the wives to come back later and prepare food, and it's not done. You see, I know it's a male-dominated world here, a part of our culture, so to say, but there are certain things we need to change as well. Not because, you're going to the Western world. Even right here, it could be changed right here. If you have to come back before your wife, there are certain things you need to do before she comes back to assist her, prepare some things. So when she comes back, it's a lot easier. And if you don't want it that way, let her prepare a series of soups and whatnot and put in the freezer for you when you're back. Go there, take it, and then eat. You don't have to wait for her to come back and then she starts. For me, I don't buy the idea one bit. So there are a lot of things we can correct right here and even have a dialogue, come into agreement with each other and stop saying that, no, it has to be you, it has to be me. No, we just need to do it together. That's my take, and that's the way I say it.
Chukwebuka, thanks for sharing it on the show. On WhatsApp, the number 080-959-75805. 080-959-75805. You can leave me comments on Facebook as well. Facebook is Nigeria Info FM, Nigeria Info 99.3. That's our Facebook. So leave me comments and I'll read them. Nurse Olumuyiwa, who's a male nurse and who's thanking me for this topic, says, that was a great interview you had. Female nurses, even here in Nigeria, are suffering from domestic violence, all in the name of our so-called culture. Men in Nigeria generally need psychological adjustment. More messages are dropping on WhatsApp, but let's talk to Anthony in Ikeja, who says a woman cannot be the head of a family. Why, Anthony?
Yes, because it was not meant to be so.
By who? Who didn't meant it to be so?
Right from creation. Is it a woman that marries a man or a man that marries a woman?
In India, it's a woman that marries a man.
We are not Indians. We are Nigerians.
You asked a question and you didn't specify, and I gave you answer.
No, you can't tell me about India because I don't live in India. I live in Africa.
Okay.
And I'm a Nigerian.
Okay.
You see, the problem we have is that we try to muzzle everything together. Each group of people has their own culture. And no matter how much you are educated, your culture still influences the outcome of your marriage.
All right, Anthony.
Or how people view marriage.
Let me ask you a different question. So you've answered that the man is the head. How do you think domestic violence in a marriage should be handled?
Well, no culture condones violence.
Okay, but how should it be handled?
Even in our own society, it's not condoned.
How should it be handled? Should the police come or should families settle?
No. From here where we are, we don't need to invite the police.
So family should settle it?
Yes, to some extent.
Okay. What if family keeps settling and it keeps happening? What should happen?
There must be a reason why it reoccurs.
What if the reason is with the person who is doing the violence, not the person receiving the violence?
On both sides, there must be issues. If there is no mutual respect, if there is no love, there must be violence. Okay,
so it keeps happening. What should happen? Do you think domestic violence is a good reason to leave a marriage?
Of course, definitely. As a woman, when I was growing up, let me just tell you, my father and my mother used to have issues.
Okay.
And once it happens, what the woman do? That she will leave the house and go to her parents' house.
Okay.
To save her life first.
And she'll come back and she'll be beat up again.
Yeah. No. But at a point, I think both of them become more matured and know how to handle their issues. And then the kids were growing up. So it's done on them that, look, it can no longer continue. But if it's life-threatening, I will always advise the person to save your life.
But we never know which one will be life-threatening. The wife can decide to stab you one day, but meanwhile, she's been slapping you before.
There is a difference between quarrel and violence. When you say something is violent, that means,
No, hold on. Quarrel is when you're shouting at each other. As soon as somebody don't carry hands, slap another person, a violence.
Yeah. But, some people, those that can endure, they will endure. But if you know that you cannot enjoy it, and somebody's going to take your life because you're married, then you have to leave.
Anthony, thanks for calling us. So, Amy is in Festac. Hello, Amy.
Hello, good afternoon.
Good afternoon. Welcome.
Yeah, my thought on this topic is this, right from the beginning, by the grace of God, I'm a Christian, and in which I want to believe is the same thing in the Quran,
Okay.
that the man should be the head of the family.
Okay.
Now, looking at that, or we understand, if there is any problem, trouble at home, whatever, maybe there is violence and all that. Even if the woman is going to leave or the man is going to leave that marriage, according to what I believe, then if he's going to leave based on his own, maybe to save himself from the violence, then he should not remarry and not go into maybe adultery or whatever, because remarrying to me, I believe is going to be like an adultery. Then apart from that, on the issue of the man being the head of the family, that doesn't mean that the woman cannot support the man at home. And that doesn't mean that the woman is a slave at home. No, it's not like that. And that doesn't mean that it's the man that will make all the decision at home. No. But at the same time, as God has put it, and we cannot change it at this point in time, God has put it there that the man should be the head of the family.
All right, Obeyemi, thanks for calling. Lambert is in Badagry. Hello, Lambert. Thanks for calling us. Hello. Hello, Lambert.
Hello.
Yes, welcome
Angela.
to the show.
Yeah. You see, Angela.
It's Sandra.
I was talking to the other lady. Okay, Sandra, sorry.
It's okay.
I was listening to your conversation with the other man that spoke. The guy that came in, that said he lives in abroad sometime, whatever. You see, let's be sincere. Even me and you, if you have a child, maybe that child grew up and he has a wife, and at the end of the day, the wife is in control of everything. As an African person, like we were brought up, you won't be happy. Let's be sincere with each other. I've been to a lot of countries also.
Okay.
You won't be happy. So what I would advise people traveling abroad, if you are an African person, you are traveling to America, the best you can do, always remember your upbringing from where you are coming from. You don't have to go there and it's not compulsory you emulate Americans.
No, but again, if you're saying that, and you're saying that when people, women especially, who get to a country that recognizes their rights as human beings, because human rights and women's rights is human rights, really, that's what it is. So all of the way that you have been treated as a man in Nigeria, that woman is now going to be treated like that and backed up by the law, and that's how she can, for instance, inherit from you, right? In Nigeria, meanwhile, you can use your manness and block her from inheriting.
No. You see, I think you're also happy that maybe women's house, right? No. See, let me tell you, even every wife you have in your house, your wife has her own right. She's got a right. Not that because she's married to you, she's a slave. No. Because some people misinterpret it. When you're working at home, doing what you're supposed to do, your responsibility, things that may be slavery. It's not slavery. White men don't see it as slavery. Some men even do a lot of things.
No, I'm addressing this because you mentioned when you go abroad, don't forget your culture. What culture exactly are you not forgetting?
To you.
What's the culture that people shouldn't forget? Okay, so what's the culture people shouldn't forget?
God bless you. One of the culture, you must remember it. You should realize that your husband is the head of the house.
Okay. What does being the head of the house mean? Lambert, what does being the head of the house mean?
God bless you. You see, the other man talk about maybe women being the head of the family, richer than the husband. It doesn't mean the lady is the head of the family. If only she wants to be rude. I'm an estate consultant. My office is in Ikoyi, and I've done transactions with women that are fucking rich, stinking rich.
Okay, so let's mind the language.
Sorry, I realize that. Thank you. You know, before I've seen a woman that she wants to buy a property worth over 1.something billion. She has to ask her husband. If the man says no, she won't buy.
And you think that's okay? You think that's right?
Why do you marry to a man that you don't understand? Like a man was talking at a guy called. He said, you must have understanding. I was like, you must have agreement. I wanted to ask, what agreement? You are married to somebody whom you love and you appreciate him and he understands you. So before I got married, I should ask my wife, okay, now let's have agreement. This is what we are going to do. This is what you don't do. It's not possible. Is that possible? You know him. We are already, of course, it's your boyfriend before he became your husband. And you know how you behave, all of this. Nothing is changing. So why do you go to other country and because you are in America, you say, those things you are doing in Nigeria, you cannot. No, things are stupid.
Lambert, let me talk to Gabriel. Thank you so much for calling us. Gabriel is in Ikoyi, and I have 1 minute for Gabriel, even though he's been waiting for a while. Welcome.
Yeah, good afternoon.
Good afternoon.
Yeah, my own take, if I'm the one providing 95% of the finance, I not see the reason you should ask me to enter kitchen and go and cook.
Okay.
If me and my wife provided 50-50, if you want us to do it the way they do it in the Western world, there's something wrong with that. If you want me to enter kitchen, we do it 50-50, no problem. To me, I'm ready for that. If I provided 95% of the thing, I will expect my wife to do the cooking and do some other things.
Okay.
I will assist him, the one I have opportunity to also assist him.
Okay. All right, Gabriel, thank you for calling and keeping it very simple. Next week, let's talk about domestic chores, shall we? Why is it such a problem? Why is it that once it comes to domestic chores, we just assign it to women, you know? Let's have that conversation next week. We're out of time on The Glass Ceiling today. It's always a pleasure to talk to you on The Glass Ceiling. Facebook is Nigeria Info FM. Leave me your comments there. I want to read them. Twitter is also Nigeria Info FM. And if you want to tweet at me, SEZEKWESILI. That's my Twitter handle, SEZEKWESILI. Find me on Instagram and Facebook as well, Sandra Ezekwesili. Let's talk about some of these matters. Now, on the other side of 5 o'clock, let's talk about World Youth Day, International Youth Day. The newsroom put together a special documentary.
99.3 Nigeria Info.